Well, in 2020, 60 million of people in Latin America and the Caribbean faced malnutrition because hunger during the year of the pandemic, almost 14 million more than in 2019, with an increasing of 30% in 1 year, the year of the pandemic. The number of hunger in the has been increasing since 2000, sorry, in 2014. However, in 2020, an unprecedented increasing in this indicator was observed. Thank you, Louise, for this opportunity to present for all of you in this very important event of ILSI, and to share with you the FAO agenda in Latin America against hunger and malnutrition and food insecurity. Well, my declaration of non-conflict of interest. Hunger in the world has increased drastically. In 2020, up to 811 million people suffered from hunger. In the Latin America, in the Caribbean, 60 million of people have difficulty to access enough nutritional, healthy, and fresh food to meet their daily energy needs. In this context, in Latin America and the Caribbean, it's related to the impact of COVID-19, including substantial increasing in poverty, hunger, food insecurity, and malnutrition in all its forms. In 2020, 267 million of people face difficulties in accessing enough safe and nutritious food for normal growth and development and in active and healthy life. 60 million more than 2019. When people experience moderate food insecurity, have reduced the quality and or quantity of their food and are uncertain about their ability to obtain food because of the lack of money or resources. Moderate food insecurity can increase the risk of some forms of malnutrition, such as stunting, overweight, obesity, and micronutrient deficiencies. People experience food insecurity in the severe category when run out of food, and the most extreme, they have gone days without eating. This group of people are those we call the hungry. The number of severely food insecure people derive from the food insecurity experiences scale, FIES. We complement with the number of hungry people with determinant based on the prevalence of undernourishment or hunger indicator by the SDG number 2. In Latin America and the Caribbean, we have a gap in gender food insecurity. This figure shows the prevalence of food insecurity at different level of severity among adult men and women worldwide and in all regions. In the box, you can see the Latin American, which is a most big gap in terms of difference between food insecurity among men and women. And this is the data for Latin America and the Caribbean in 2020. 42% of women in Latin America and the Caribbean experience moderate or severe food insecurity, compared with 32% of men. And across of this region, the difference is slightly more pronounced in Mesoamerica, in Central America, and less in South America. Regarding with the malnutrition data, we have a lot of overweight and obesity, as you can see in the graphic. In adults, 260 million of people is overweight, and more than 100 million of people is obese. Latin America and the Caribbean is facing a critical situation in terms of food insecurity and malnutrition in all its forms. The region has shown important progress in reducing stunting, having reduced its prevalence from 80% to 11% in 20 years. Although of that, we have near to 5 million of children under 5 with the stunting, and overweight and obesity is increasing in all age group, particularly in children under 5, which is 7.5%. almost 4 million of children under 5 with obesity or are overweight. In school age children, we have a prevalence around 20 to 40%. And micronutrient deficiency, particularly anemia or iron deficiency anemia, is the most common nutritional deficiency in our region. The new framework for FAO in the global level prioritize 4 betters. This is a new framework, and we are working to promote better nutrition in all our activities in the region, along with better production, better environment, and better life. This is the 4 betters and the prioritized area to work. In the case for nutrition, we are working to strengthen different aspects of the healthy diet access to fight against hunger and food insecurity. I would like to present different action that we are doing in Latin America, particularly in Central America, with the support of different counterparts such as ABC or the Brazilian cooperation or Mexican cooperation to improve food insecurity or to improve food security and to fight against hunger and malnutrition. This is the school feeding program that we're promoting. Is a very innovative approach to implement the school feeding program based in 6 elements. The first is the institutional and intersectoral articulation, working with different stakeholders at the political level and also parliamentarian to promote laws in different countries. For example, in Guatemala, Panama, Honduras, and Dominican Republic and El Salvador, they are preparing a new laws for school feeding to strengthen this policy. The second level is social participation, with the participation of the students, mother, partner, teachers, etc. And also actors for the local level, for example, family farmers. Another and very important component is food and nutrition education, because we can promote a healthy nutritional habits at the school using the school feeding, but also using the curriculum to integrate healthy nutrition and healthy food habit in the curriculum. Improving infrastructure, we are thinking that the children need not only the food, they need the right condition to receive that food. It means that we need to have kitchen, we need to have a space to receive the food. And also in this component, we are working to facilitate the access of water, safety water at the school from different technologies at the local level. Adoption to adequate menus, in particular with the alignment with the FBDG of food-based dietary guideline. And of course, the last is the purchase from local family to increase the fresh fruits and local cultural pertinence for the menus that they are receiving. I would like to present a very short video. In the next slide, please. Could you start? Okay.
Hoy el almuerzo es pollo guisado, proteína, con berro. ¿De dónde viene la comida? De productores, agricultores del área. Eso es importante. O sea, eso es un recurso adicional. Esto es un menú nutritivo, cumple con todos los requisitos de nutrición que requieren niños de esta área.
Los niños van a recibir panfletos, van a recibir guías, vamos a trabajar con la capacitación con padres de familia, vamos a promover los huertos familiares y los huertos escolares. O sea, es un proyecto completo para que cuando ese niño vaya creciendo, vaya comprendiendo la importancia de alimentarse saludablemente y cómo puede impactar también a su comunidad y el desarrollo de toda esta área.
Aquí nos ha ayudado muchísimo el conocimiento de la FAO, en coordinación con el MEDUCA, con el MIDES, con el MIDA, el Ministerio de Salud. Yo me siento muy contento cuando yo veo las caras de estos niños comiendo comida nutritiva. Este es un proyecto lindo. El tema de nutrición es fundamental. Un niño desnutrido, por muy buena infraestructura que tenga, por muy buenos docentes que tenga, no hay manera que pueda asimilar. Pero por eso es que es el énfasis que se le ha dado al programa Estudiar sin Hambre.
This is an example of the political transformation of the school feeding program in Latin America. We are supporting with the Brazilian experience and the Brazilian cooperation. The next one is the experience in food and nutrition education. Also in these three level, the political always is very important to implement our intervention in different level and with multi-sectorial approach. The first level is at the political level. In that case, we are conducting different assessment tool to analyze the capacity of the Ministry of Education and also the other ministries working in nutrition education to implement that kind of intervention. At the sectorial level, developing guidelines, manuals, materials, educational tools for teacher and also for the students and family. And in the territorial level at the school, we are implementing pilots or different development experience to implement the nutrition education using a different approach through plays, through different or innovative approach. This is the document that we are promoting, the nutrition education at the school. The white book is a global book from FAO headquarters, and also we are replicating this initiative in Dominican Republic, El Salvador, Ecuador, and right now in Guatemala. And food and nutrition education at the school helps school children and their communities to achieve lasting improvement in their diet and other food practice, as well as in their attitude, knowledge, practice to develop their ability to change and adapt the external, adapt the food eating habit. Okay. The next one is FBDG, or food-based dietary guidelines. We are improving the guide to the country to develop a new approach for the FBDG. Right now, we are proposing to use the food system-based dietary guideline to integrate the food system approach into the development of the FDG. Right now, in Mexico, Ecuador, Dominican Republic, Costa Rica, Suriname, they are working in this new approach of food system-based dietary guidelines. And we support different guidelines for general population or for children under 2, pregnant and lactating women. The next one is food labeling, or food front of the package food labeling, which is a Latin American experience using this kind of a warning label in front of the package to inform the consumer about the risk for the health, because the product, if the product has more than the different critical nutrients such as sugar, salt, trans fatty acid, or total fat, and also calories. This politics is implementing in Chile, which is the first one using this kind of label, and then Mexico has also in front of the package warning label for food, processed food. Ecuador has the semáforo, Peru, Uruguay, Argentina, and in discussion for the new laws is in Panama and the Dominican Republic. They are working with in front of the package warning label. This slide showed you the importance to work with the parliamentarians, because all our activity need to be supported by a law or a normative framework to ensure the sustainability, the political sustainability. The Parliamentary Front Against Hunger in Latin America and the Caribbean is a parliamentary and plural network with a presence in 21 national parliamentarians, as well as in 5 regional and or subregional parliaments. For example, the Parlatino, which is the Latin American Parliamentarian Group, when we prepare different activity to train the capacity in the parliamentarian. It also has important alliance with other parliamentarians in the world, with the Brussels, the European Parliament, in which we work to exchange experience. Well, my last is the take-home message. The region is facing an unprecedented crisis of poverty, hunger, food insecurity, and malnutrition. The current conflict can affect the production, and also we are thinking that we can be in the door of the new food crisis because the conflict. Climate change, maternal child malnutrition, and the effect of the COVID and obesity pandemic hit the most vulnerable groups, if children, women, elderly people with disability, and in particular in the indigenous and rural context. Working in an alliance with, for example, with ILSI, allows us to do a very good technical assistance for the country in the development of initiative, for example, school feeding, nutrition education, FVDGs, or in the political aspect, working with the parliamentarians to propose a different law. An additional example of our working with the parliamentarians, including not only the school feeding or from in the package labeling, but also family farming law or food security law to ensure all these activities in the countries. Well, thank you very much.